begin.
Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now in this episode, I'd like to discuss a very popular point of discussion I've been having in private chat sessions over the past few days, and that's the difference between the common cold and the flu. Now, if you don't have the Acupuncture is My Life app, go to the Google Play Store and download it to gain access to free telehealth and to learn more about acupuncture and Chinese herbs and plant enzymes, as well as engage in private chat sessions with Acupuncture is My Life acupuncturists to discuss how you or a loved one may benefit from acupuncture. Now, back to the topic at hand. You see, headed into cold and flu season in the midst of a COVID-19 pandemic, many people are concerned as to how can they differentiate between the common cold and influenza. Now, I've done quite a few episodes on the coronavirus in which many have watched, so they're quite aware as to its symptomology, but are concerned at this point more so with the common cold and the flu. Now, as I've stated in my chat sessions, I'll say again, the common cold and the flu are both respiratory illnesses that are as a result of different viruses, but it can be difficult to tell the difference between the two based on symptoms alone. Overall, the flu is worse than the common cold and its symptoms are more intense. Colds, more times than not, do not result in serious health problems. Cold symptoms usually begin with a sore throat, which usually disappears after a day or two, followed by nasal congestion, runny nose, along with a cough, usually around the 4th or 5th day, whereas fever is usually uncommon in adults, but more common in children. Now, cold symptoms usually last for about a week to as long as 10 days and can sometimes be mistaken for allergic rhinitis or even sinus infection. As for the flu symptoms are usually more severe than a cold and present with symptoms such as sore throat, fever, headache, muscle aches and soreness, congestion and cough. Now, most flu symptoms can gradually improve over a 3 to 6 day period and can leave an individual with post-viral fatigue, in which I spoke about in my last episode. Now, you must be aware that pneumonia can be a complication of the flu, especially in young people, the elderly, and individuals with lung and heart issues. Now, here are some of the ways in which you can differentiate between the common cold and the flu. Let's say, for instance, fever. With the common cold, if you get a fever, it's usually mild, whereas with the flu, a fever can be pretty common. As far as a headache, headaches are usually occasional when it comes to the common cold, whereas with the flu, it's common. And let's say general body aches and pains when it comes to the common cold, it's usually slight, whereas when it comes to the flu, it's common and in most cases severe. Let's say fatigue and weakness it's sort of a sometimes with the common cold, whereas with the flu, it's common and can last somewhere in the ballpark of, let's say, 2 to 3 weeks. Now, extreme exhaustion does not occur as a symptom of common cold, but when it comes to the flu, it's usually the case around, let's say, the beginning of the illness. Now, stuffy nose is common for a cold, but not so common when it comes to the flu. And sneezing is more common when it comes to a cold than the flu. Whereas with sore throat, it's common when it comes to the cold, and it's less common when it comes to the flu. Now, when it comes to, let's say, chest discomfort, it's usually mild with possibly a hacking cough, but it's common and sometimes severe when it comes to the flu. So you see, complications of the common cold, let's say, can be sinus congestion or a middle ear infection, whereas with the flu, it can be sinusitis, bronchitis, ear infection, pneumonia, which can be life-threatening. Now, these are the basic, I'd say, differences between the common cold and flu. But in my chat sessions, I was asked by two individuals to go further into detail from a Chinese medicine perspective. You see, when it comes to traditional Chinese medicine, there are two aspects of the common cold in which an acupuncturist has to consider, and those being either the presence of an exterior pathogenic factor or the deficiency of righteous qi. Now, if your righteous qi is intact, it's usually very difficult for an exterior pathogenic factor to penetrate to your protective qi. Now, when it comes to exterior pathogenic factors, the common cold is usually caused by a wind pathogen, usually in the form of wind cold or wind heat, or even summer heat dampness, and I've stated this in past episodes. Now, this is because wind as an exterior pathogenic factor is prevalent year-round and combines with pathogens for each season as it attempts to invade the body. That's why when your righteous qi is not intact, wind combined with that particular seasonal pathogen can penetrate through the body's protective qi. Now, another aspect can be interior pathogenic influence, whereas again, deficient righteous qi can present as, let's say, lung qi unable to disperse, leading to your body's protective qi failing to consolidate the surface. That surface being your skin and the space right underneath it. Now, some of the basic patterns of common cold in traditional Chinese medicine can be, as I said, exterior wind cold, where the patient can present with, let's say, an aversion to cold, fever, no sweating, headache, general body ache, and there's usually nasal congestion, sort of like with a clear discharge, an itchy throat and cough, but with no desire to drink liquids. Now, another pattern can be wind heat, where the patient can present with fever, slight aversion to wind, obstructed sweating with a distending headache. In this case, there's usually nasal congestion with yellow discharge, and let's say a sore throat, cough with sticky yellow sputum, and a desire to drink liquids. I won't go into all of the basic patterns, but another can be exterior summer heat dampness, where the patient can present with fever, slight aversion to wind, slight sweating, soreness of the body, and a headache that has a heavy, distended, cloudy sensation to it. In this case, there's usually a cough with sticky sputum, nasal congestion with a turbid discharge, irritability, chest congestion, and scanty urination. Now, these can be some of the several basic patterns of common cold in traditional Chinese medicine. Now, when it comes to the flu, in traditional Chinese medicine, this virus is seen as epidemic cold disease because of its severity, high transmissibility. It can be pandemic in nature and can have systemic symptoms that are severe when it comes to internal organ involvement. Now, the flu can invade the body faster than the common cold and is different from the common cold in that it can be considered like a wind-warm febrile disease or a summer-warm febrile disease. Just like the common cold, the flu is caused by a person being attacked by wind as an exterior pathogenic factor, and again, the person's righteous qi is deficient. Now, this type of wind as a pathogenic factor is more common during non-seasonal changes of weather. Now, some of the basic patterns of the flu in Chinese medicine can be, let's say, wind heat attacking the protective level, where the patient can present with, let's say, a high fever, slight aversion to wind, headache, body aches, nasal congestion, and sore throat. Another pattern could be pathogenic heat affecting both the protective and qi levels within the body, whereas the patient can present with fever, aversion to cold, red face, desire to drink cold fluids, irritability, dark urine, body aches, and a cough. There are more basic patterns such as, let's say, heat accumulation in the lung, heat lodged in the pericardium. Now, I had an interesting case last flu season where I diagnosed a patient with lung phlegm heat, where he presented with a high fever, restlessness with a desire for cold liquids, in which he'd vomit it up right after he drank it. Now, there was a cough with breathlessness, pain in his chest area, and he would cough up profuse amounts of yellow, sticky sputum. And he stated he'd feel nauseous from time to time, as well as stating he was experiencing dry stools and dark urine. Now, his tongue was red with a slight sticky yellow coating. And after conducting a pulse diagnosis, I knew I had to clear lung heat and resolve the phlegm, as well as restore the descending of lung qi and prevent further injury of yin. So I needle points on the lung and large intestine channels to resolve phlegm heat from the lungs, as well as to clear lung heat. I also needle points on his stomach, pericardium, and spleen channels to resolve phlegm and stimulate the descending of lung qi, as well as open up his chest to clear heat by nourishing yin. I needle point a point on the governing vessel as well to reduce the high fever. And he fared pretty well after 3 treatment sessions, and he continues to come to my office to this day, once a month for wellness visits. Now, this is how I, as an acupuncturist, can differentiate between the common cold and the flu in Chinese medicine. Now, if you're ever interested in engaging in a private chat session, as well as learning more about Chinese herbs and Eastern nutrition, simply go to the Google Play Store and download the Acupuncture is My Life app. And don't forget to subscribe to this channel. And until next time, Acupuncture is my life. What's yours?